as the patients with neurodegenerative disorder experience a lot of neuropsychiatric symptoms, it has led to that dementia often is misdiagnosed as a late-onset primary psychiatric disorder. So I think a lot of studies right now is trying to figure out some biomarkers to distinguish those with late-onset primary psychiatric disorder, for example schizophrenia, and those with an FTD. And I know one study that has shown like NFL, plasma NFL can help and distinguish these two, for example. So I know that is a lot of studies going into. My approach is more looking into to see like genetic factors just to help with the diagnostic process, but also enable kind of the knowledge regarding like the genetic architecture of these two different types of disorders. We are not there yet. And this is an answer regarding like the genetics part. I'm sure that the using like plasma NFL and plasma biomarkers, and maybe also CSF biomarkers, is more closer to be used in the clinic to distinguish these two diagnoses, and in some cases I think even used now that this information has been released. But like in the name of genetics, we are still trying to understand to which extent we can use, for example, polygenic risk scores. I know I haven't read it thoroughly, so I wouldn't dare to say too much about it, but there are studies looking into using different methods to calculate polygenic risk scores to try to distinguish, use polygenic risk scores to help distinguish between diagnoses. And maybe that could be a path to look into even more. And I would think to some extent that polygenic risk scores or genetics of psychiatric disorders and of dementia could help distinguish diagnosis, but not to be used like alone in connection with all other types of measures that we use.